Hello, this is Dr. Clark, and this is Chapter 11, McCurnin's Reproduction. So this will be for Week 8 lecture, and we're going to go into animal reproduction, otherwise properly known in veterinary medicine as Theriogenology. So we're going to start off with just a basic overview of mammalian reproductive anatomy, which is something that we already went over in AMP2. It's important to know that the hypothalamus is the control center of the reproductive system. It's going to take usually negative feedback of hormones like testosterone, progesterone, and estrogen, and it's going to tell pituitary what hormones need to be released in response to those hormones. And so it works off of primarily a negative feedback system. The pituitary is going to send out hormones, follicle-stimulating hormone and luteinizing hormone, which is going to stimulate the production of things such as estrogen, progesterone, and testosterone. And then you also have the pineal gland at the back of the brain, which you remember kind of are back of the diencephalon that kind of controls the registers the amount of daylight, and it has the control on animals that are going to be seasonal breeders. And so depending on the amount of daylight the hormones released, they're going to decide when those animals are going to come in and cycle and have estrous cycles and be able to be pregnant. Gonads in the females, these are the where the actual cells for reproduction arrive. So you have the ovaries, which are going to produce the oocytes or the eggs, and the testes. In the male, you're going to have sperm produced at these areas. Tubular genitalia, this is going to be things like oviducts in the uterus in the female, the vas deferens and the accessory sex glands and their ducts in the males going into the urethra. And it's very important when we're looking at this to understand, have a basic understanding of endocrinology and how these hormones actually work, and they signal within the endocrine system. And if we have something off in the endocrine system, it will totally affect all the rest of reproductive activity and behavior within that animal or within that specific species. And also endocrine glands do play an important role a lot of times in actually not only helping the animal to come into estrus and become pregnant and the males to actually produce sperm, but they play a large role also in determining when to terminate the pregnancy, whether that's a natural end or if it's a premature one such as abortion. Looking specifically at the physiology, on the female side, we're going to look at ovulation really quick, and this is the release of the egg, also known as the oocyte from the follicle. If you remember, these are going to be made through meiosis, not mitosis, meiosis. These are sex cells. You're going to have three polar bodies that are going to be a support cell to one oocyte. The oocyte is going to develop inside of a follicle. That follicle is going to increase in size and fill with fluid until it actually physically ruptures, and releasing the oocyte to be traveling down into the oviduct so that it may be fertilized by the sperm. Once ovulation occurs, there's actually going to be a blood clot that's going to form in its place, and this is going to be called a corpus hemorrhagicum. And this corpus hemorrhagicum is going to become important because it's going to actually give the support structure, the blood clot in there, the matrix for cells from those polar bodies to actually go out on, and they're actually going to eventually make something called a corpus luteum, and that corpus luteum is actually going to sit there and help produce progesterone that is going to maintain the pregnancy if the female becomes pregnant. And so there's a whole bunch of hormonal controls, and this kind of shows you the basic hormonal control. Once again, remember that this is going to be controlled from the anterior pituitary, not the posterior, but the anterior. And the anterior pituitary is going to get signals from the hypothalamus. So what's going to happen is the hypothalamus is going to sit there and it's going to look at what hormones are being produced, estrogen or progesterone. If progesterone is starting to decrease, a lot of times the hypothalamus will in turn change the amount of GnRH, and resulting from a decreasing amount of progesterone. And if there's a decreasing amount of progesterone, which we're showing right here with regression of a corpus luteum and follicle growing and an increased amount of estrogen, it's going to produce more GnRH. And the more GnRH is produced, the more follicle stimulating hormone is going to be released, and that in turn is going to keep and continuing to increase estrogen levels until you get to a point where there's enough estrogen levels being produced that all at once the pituitary is going to start slowing down follicle stimulating hormone, and it's going to increase luteinizing hormone, and luteinizing hormone is going to increase, and it's going to cause that follicle to rupture, and that ruptured follicle will turn into a corpus luteum, at which time estrogen will decrease and progesterone will increase, and it will go back, and it will actually, this change in progesterone will actually change the amount of GnRH, and will actually sit there and actually kind of stop some of these FSH and LH hormones. If the main pregnancy is maintained, then progesterone is going to continue to be produced. Some of these other hormones are going to be staying at a lower level, and then after birth, these hormones will change and the heat cycle will start again. If the female is not pregnant, the body will send a signal to the corpus luteum and tell it to dissolve and go away. And once it goes away, we start back over here with decreasing progesterone, increasing estrogen, and the whole cycle starts all over again. And this is actually pictures of corpus hemorrhagicum. This is probably from that of maybe a cow, where you actually can see the blood clot that's actually formed from rupture of the follicle there, and it actually creates this blood clot that the corpus luteum is going to form within. Fertilization is something that occurs near within the oviduct. They say near the junction of the ampulla and the isthmus of the oviduct, but it's somewhere right there about the middle of the oviduct. The embryo is actually going to sit there, or actually at that time it's a zygote after fertilization, is usually going to stay there roughly 7 days within the oviduct before it actually travels down into the uterus. If there's no embryo, there is no fertilization that occurs there, then basically the egg is going to die and be reabsorbed into the body. If pregnancy is detected by the uterus after 7 days, there'll be hormones released that keep the corpus luteum intact in most species. The only one we'll speak about is a little bit different on the way that horses do things, but all the rest of them, the corpus luteum will be in charge. And once it's dissolved, that's what's going to lead to parturition and the fetus being expelled from the female during parturition and turning into a neonate. If there is no pregnancy, then generally at some determined time, the corpus luteum will dissolve and the female will come back into estrus again. So the estrus cycle itself is going to be sit here, and there's going to be multiple things that are involved with it. So we've already talked about the hypothalamus and it producing GnRH, the pituitary gland, FSH, and LH, the ovary with estrogen and progesterone. The uterus and its tone and its condition and whether or not there's an infection involved will also play a role. So if we have a low-grade uterine infection like a pyometra or a metritis, a lot of times this can actually have a negative effect on the ovaries and on the feedback system, and it can actually either cause one or two things, an absence or a lack of estrus, or a lot of times what it actually does is it actually ends up causing an ongoing estrus. Sometimes we can get ovaries that actually get cysts and they continue to produce too much estrogen, and the follicle will not rupture, and we actually call those cystic ovaries, meaning that the follicle refuses to rupture and just continues to produce more and more estrogen, and these animals will stay in to estrus for a very long time. And there is some variation as far as how long estrus lasts. We do have, or lasts. We have some animals that actually need stimulation of the clitoris to actually ovulate, specifically cats. We also see this in a lot of our camelids. And once again, don't forget the pineal body. It's important. If we have some of these animals we're going to talk about are going to be seasonally estrus, so they're going to come in at a specific time. When we look at the embryo, once the oocyte becomes fertilized, it becomes a multicellular, what we call blastocyst, also called a zygote, and it develops the placenta. on the outside, and usually the placenta is actually going to develop from the outer layer called the ectoderm. But we have, embryologically, we have three different layers that we have down here that we need to know. One is the endoderm, so this is going to make, the endoderm is usually going to be responsible for making things like the intestine, the liver, the kidneys. The mesoderm, this is the layer where you're going to get things such as the muscle, the heart, the lungs, the things in the middle of the body, the skeleton, and the ectoderm. And the ectoderm is going to make skin, some of your other epithelial layers, such as mucous membranes and such, come from the ectoderm. And also the nervous system. The nervous system and the central nervous system specifically actually develops from the ectoderm. A couple of terms to know here, and it's actually not underneath the embryo page, but it's actually up above it, is what they call superfecundation. Very hard word to say. But this is something that's very common in litter-bearing animals, where we can have multiple sires of multiple offsprings. So like in a dog or cat, you might have 2 or 3 dogs hanging around, or 2 or 3 cats hanging around, a bitch or a queen, and it's possible that when you have the litter, there's more than one father to the 5 or 6 or 10 offspring. This is not to be confused with superfetation, which is where the dam can actually conceive again while still pregnant. And this is possible somewhat in primates, but mostly we see it in other animals that have bare litters. And specifically, I think it's actually seen more in smaller animals such as rats and mice and very high litter-bearing animals, that they can actually be pregnant, come into heat, and get pregnant again. Parturition, this really is not one to follow along with the book, but they don't really list out the stages, so we're going to go back over them again. We've kind of talked about these different stages, and you'll see here. Stage 1 is the starting of contractions, and sometimes parturition even starts with things like stage 1, like in dogs, can be actually considered to start with nesting behavior. So there are denning behavior, where they're actually starting to make a den or a nest. And so this can be as long out as 2 weeks, and it can be as short as 12 hours. So there's a great variability, but you're going to have contractions, the starting production of milk and for lactation in stage 1. And stage 1 enters, starts and then ends actually with stage 2. And stage 2 is where we actually have the fetal membranes actually leave the uterus through the cervix and actually enter into the pelvic canal. This is usually when the water breaks. And this stage 2 is going to go from when these fetal membranes enter into the pelvic canal and the water breaks until the fetus is fully developed fully delivered as a neonate. So once the fetus is fully delivered as a neonate, stage 2 ends. Stage 3 begins at that time, and stage 3 actually ends with full expulsion of the placenta. So remember, those are the 3 stages of parturition. We talked about it in equine. We've also talked about it in AMP2. So just a reminder, those are the 3 stages. When we get in the male reproductive anatomy, it's a little bit different than the female. You're going to have the gonads are going to be external in males, with the testes, the ovaries, and the females are kept in the abdomen. The female reproductive tract is all inside. The male reproductive tract is going to be external with the penis. And a lot of times the urethra is going to be where not only urine comes through in the male, but also where sperm and spermatic fluid is going to travel through, unlike the female, where most reproductive things are going to stay within the vaginal vault, separate from the urinary system. When we look at hormones in the males, a lot of these hormones are going to be exactly the same as females, except for the difference of testosterone. So females have estrogen and progesterone. Males work on testosterone. They also have a hormone in here called inhibin, which actually works as the feedback against testosterone. Specifically, GnRH controls a lot of, once again, what's going on here. It stimulates things like FSH in the male, and FSH is actually important for stimulating sperm production. So a lot of times GnRH has a direct input on FSH, and this FSH in the male is going to actually cause production of sperm. Whereas luteinizing hormone, or LH, actually causes increased levels of testosterone in the male. And if testosterone gets too high, then a lot of times what happens is we actually have inhibin amounts that actually start to increase that will actually decrease the amount of testosterone. So it's still in a negative feedback system. We just talk about the hormones a little bit differently here. Spermatogenesis, so there's different stages of actually sperm being made. There's basically sperm production, which is from the Sertoli cells, called spermatogonia. Sorry, I had to trip on that word a little bit, but it's made spermatogonia. That's from the Sertoli cells. These are the basic stem cells. And spermatogenesis actually starts here. And basically you have meiosis that's going to go through and is actually going to produce the actual basic sperm cells. They're actually going to sit there and split off from these Sertoli cells, these stem cells, and they're going to split into 4 different cells with half the number of chromosomes in them needed. One thing to know about during this is where in mammals, we determine whether the sex is going to be male or female. If it has an X chromosome from the cell that's divided from meiosis, one of these 4 cells, it will produce a female offspring. If it has a Y chromosome, it's going to produce a male offspring. To actually go from being these little stem cells, we have what we call, they become these young little spermatid. And the spermatids actually go through multiple morphologic changes. So they go from being these round little blobs to eventually having that long whipped tail that we know as sperm cells when we see them, the little flagellated cells. And spermatozoa are the ones that are fully differentiated and look like the actual sperm cell. So a spermatid is an immature one. It doesn't look that much like an actual sperm cell, but the spermatozoan is one that's actually going to be fully differentiated. And remember that maturation of the epididymis occurs in the epididymis. So these sperm cells are actually going to sit there and they actually mature and fully within the epididymis and not actually within the testicle itself. So a lot of spermatids are made in the testicle. A lot of the larger cells live there. They kind of become crude spermatozoan, but they fully mature within the epididymis right off the testicle, the start of the vas deferens there. So next we'll go into the canine reproduction. And so some of these things are general terms that you're going to hear. And so female dog is called a bitch. Male dog is going to be called a stud or dog. Whelping is canine delivery. Pups or puppies are the offspring. Neutered male is a castrated male. Overectomized bitch is a female with just the ovaries removed. So sometimes we'll do this where we just remove the ovaries, but we might leave the reproductive tract intact. That is done occasionally, but mostly what we go for is the spade bitch, which is where we've actually done an ovariohysterectomy and we fully remove the gonads and the uterus. So when we actually start looking generally at reproductive cycles and the reproduction in dogs, it's a little bit different than a lot of other species. And so dogs are not a very good example to look at to compare to everybody else for reproduction. And for one reason is that they only come into estrus every 6 months. And some of the rules on hormones we talked about here earlier don't exactly follow true with dogs. So dogs don't necessarily go out of estrus, not get pregnant, and come right back into estrus. Their hormones have been set up to where they pretty much come in on average every 6 months. There is some variation in this. We do find lines of German Shepherds that we have bred to actually come in about every 6 months, and so they do probably fall closer to the rules that we've talked about with hormones. But they wait until actually the corpus luteums have been reabsorbed from where they're not pregnant until they come into heat again. The other thing is we have some dogs, such as the Basenjis, which end up being monoestrus, which means they only come in once a year. So we do actually have bred some breeds of dogs to only come into heat once a year. We talk about diestrus down here, which is timing of pregnancy, which is distrus. And we also use a term too that gets confusing when we talk about it, when we talk about dogs breeding every 6 months, which is diestrous, which is diestrous. I've also seen other people now wanting to use the word biestrus, which I think would probably be less confusing. But when we look in a lot of our medical terms, they're still using this old term. And so diestrus and diestrus get very confusing sometimes when you talk about them. But the main thing that you need to take away is that dogs come in on an average of every 6 months. That's one reason why we like to spay a lot of times dogs before they reach the age of 6 months, because we can actually spay them before they ever go through their first estrus cycle. So puberty is going to be the time of their first heat cycle and first ovulation. And usually what happens is somewhere around 6 or 7 months in dogs, you're going to actually get this spike of GnRH that's going to be released, that's going to stimulate follicle stimulating hormone from the pituitary. And the increased follicle stimulating hormone is then going to lead to spikes in the luteinizing hormone, which is then going to cause ovulation. The timing in this in dogs is not really related to one estrus cycle to the next. Like I said, it's usually timed more out about every 6 months. There's some things that we know that we can see in dogs. So one thing with dogs with their estrus cycles is we can find a time called proestrus, which is the time leading to estrus. A lot of times you will start seeing changes in females in proestrus where they become a lot more restless. They start looking for males. They're not receptive to breed yet, but they actually start some of their mating behavior. And then they actually start having some vaginal discharge at this time. And this usually is about 9 days when we actually see this. And so we actually start seeing like a bloody discharge from the vulva during the proestrus stage. And this is actually due to the stimulation of follicle stimulating hormone. And we can do a cytological exam of the vaginal area. Usually we use a Q-tip. Some people actually do an actual washer flush. And we can actually help determine which stage of estrus they're in, and we can actually tell the difference between proestrus and estrus. And if you actually look on page 347, box 11-1, they actually go in how to do some of the cytology with a Q-tip, and then some of the different cell differences that you would see for different stages of estrus in the female dog. They also show some commercial kits for timing that they now have that you can sit there and actually look and figure out when they're coming into estrus and which stage they're in. Estrus can last anywhere from 3 to 18 days in dogs, so there's this big variability, and this is the time of sexual receptivity and mating in dogs, and we can actually, once again, actually look cytologically and tell when this is going to happen. If I had an average to say, it's probably about an average that estrus is a week, usually proestrus is a week, and then estrus is a week. But, you know, there is this big variability depending on the breeds that you look at. But during this time, she's going to actually be receptive to mating with the male. A lot of times, one thing with dogs is when they lock, or when they mate in canines during male and female, they actually lock. The glans penis actually swells up. There's barbs on the male's penis, and they actually hard to actually separate during that time. And we usually tell people during mating not to actually try to separate males from females, because you can actually damage not both the penis and the vagina on the females. Part of the reason that they lock up, that we have figured out, is that it actually helps the female in uptake of spermatozoa. So their locking together actually does help her get pregnant. Diestrus, this is going to be after estrus is in. Sometimes you can have some signs of estrus bleeding over into diestrus, but usually those abate fairly quick after estrus ends, and then pregnancy starts. And you're going to have the establishment of the corpus luteum for diestrus in dogs. And during this time of diestrus, this usually is going to last anywhere between about 58 to 70 days. Usually 58 is the number that we give is the shorter one, but we have some large breed dogs that can go as long in diestrus as 70 days. And this is the time of pregnancy. This is the time in diestrus is actually when we see if they don't get bred, our high rates are very large chances of them getting pyometrus, because if any bacteria gets in the estrus, it's going to sail off during diestrus, because the female's automatically dog is going to go into a state of feeling like she's pregnant even though that she's not. We can also get false pregnancies a lot of times during diestrus in dogs, because it really doesn't matter if they're actually pregnant or not. The body automatically assumes that they're pregnant during diestrus. So diestrus is a time that we watch anytime a dog has come in, female dogs come into heat. We want to make sure that we watch for signs of pyometra if she did not get bred. Parturition or whelping is when we give birth. And then dogs actually go back into anestrus, and it's usually going to go last after that. Their cycles are about every 6 months, like I said. So they're going to go about 3 or 4 months actually where they're not going to have any follicular activity or come into heat whatsoever. And so this is the way that the dog's normal estrus cycle works. When we look at breeding dogs, there's natural. And so there's several different ways. One is when she's actually receptive during estrus, is to put her, the bitch, and the stud together. We can also sit there and monitor things like hormone levels and watch for the LH spike and increase in progesterones, and do daily assays. These are expensive, but we can sit there and figure out the best time to actually put the male and female together. And this is usually done when you have people trying to breed a male and female naturally over distance. So say somebody in Houston wants to breed to their bitch to a stud up in Dallas, but they're wanting to do it 1 day or 2 days most. And so we have this variability of 3 to 18 days. So you're trying to figure out, well, when is the best time? And so there's things that we can do, like look at progesterones. We can also do cytology on the vaginal area, and a lot of times look at that and try to figure out when would be the best time during estrus to actually breed. The other thing that we actually do is we'll look at these things to decide when to use artificial insemination. And there's 2 ways that we do artificial insemination in dogs. One is going to be with fresh chilled semen. So this is going to be, or potentially fresh semen. So there's sometimes that we actually collect a stud dog and then we artificially inseminate the female with fresh semen. Sometimes we actually will chill the semen and we will have it transported for short periods of time. So it can actually be chilled and sent across the country, maybe on an airplane, to breed a dog in Los Angeles from one in New York. What's become more common and popular has actually been frozen semen. And so with frozen semen products, it's actually stored at negative 196 degrees Celsius, and it can live in there for probably thousands of years. Main thing is with frozen semen is that this is going to have a very short lifespan. So we have to be very accurate on when we're breeding the female, or we have to do multiple attempts of breeding them artificially. And this can get expensive, especially when you're looking at, a lot of times this stuff is charged by the straw. Some of the ways that we do it artificially, the most common way is vaginal. We can do surgical, where we directly implant it into the oviduct or into the uterus. And we can also go through the cervix and do a transcervical artificial insemination. But the most common is usually the vaginal technique. Some people will do transcervical too, where they have a special type of pipette that goes strictly up into the cervix. Surgical is not done that often anymore. Gestation for dogs, on average, we say is 60 days, but the normal range is 58 to 70 days. There's several different ways to diagnose gestation, and this includes palpation. So we can actually start feeling for enlargement of the uterus. because it's going to be in the ventral abdomen. And we can usually get this accomplished, really good people, about 21 days, but on average at about 30 days, about halfway through gestation, you can feel them. Ultrasound has become very useful and very popular. It's still not exactly the gold standard, but it's quickly becoming the gold standard. There's a lot of people that are very good at ultrasound. The thing with ultrasound is you're better tracking the pregnancy. So a lot of times with ultrasound, we can actually find when we actually have a fetus that's starting to have trouble. So we can sometimes actually figure out, well, out of this litter of 12 puppies, how many of them are actually likely to come out as live births? And in the orders, we can figure out if one's going to die. Usually a dead fetus is going to be where we're going to have dystocia, and we can figure out about where our dystocia problems might be at. Gold standard still radiographs, and radiographs a lot of times are done usually after about 43 days, and probably are the most accurate, probably from probably about 45 days on. And the reason for this is that sometimes at 43 days we don't have complete ossification of the fetus, and by 45 we do. And it's the gold standard because you can actually see the fetuses in there and count them, and most practitioners are very comfortable with radiographs. There's a growing group that are getting more and more better at ultrasound, but for so long the gold standard has been radiographs. It's staying that way, but I see a time when it'll become more ultrasound because of what more we can find with ultrasounds. Radiographs will not actually tell us when what the condition of the actual fetus is. It just tells us how many of them we actually have that are skeletonized in there. One thing to know about, and this also not only goes for dogs, but it's going to go for felines, which is next, is remembering that the placentas are zonary band attachments. And this goes with a lot of your litter-bearing animals. And so you can actually see here's a uterus, and you can actually see different puppies here, and you can actually see where the uterus actually segments off in between them. And it looks like there's one here that's probably not going to make it, and one here that probably will. You can just tell by that small size. But you can see all the multiple puppies in here, and their uterus is actually, or placenta is actually going to attach to the uterus through the little zonary attachments of the placenta right there. One thing here, and I don't have a slide on it, is parturition. Whelping usually, and the average is anywhere from 6 to 12 hours, but depending on the litter sizes, it can be as long as 36 hours. And that's usually for stage 1, so I would actually say it's probably closer to 12 hours, but 36 on what they're calling the stages. When I actually learned the stages, we usually considered nesting behavior actually a part of stage 1, and that actually can start up to about a week to 2 weeks before. But actual contractions and stuff are usually about 12 to 36 hours. Stage 2 is usually going to last anywhere from probably about, depending on how many puppies are in the litter, from as short as 20 minutes to, if there's just one puppy, to potentially longer than 24 hours if you have 12 puppies. And it's not uncommon for them to deliver one puppy and take as long as 2 hours before the next one comes out. So stage 2 in dogs can actually last for quite a while. Then usually stage 3 is fairly fast because usually the placenta comes out along with the puppy. So it's not that long until they actually pass all of the afterbirth. One thing to know is it's not uncommon to actually have a greenish black discharge after parturition. And this is actually from the uterus doing normal involution and cleaning itself out. So you'll have people call about this greenish black discharge, and they want to know, well, why is this greenish black discharge occurring? And that's actually going to be normal. One thing to know about parturition and know when you have problems is it is important for people to have ultrasound or radiographs done to know how many puppies do we actually have in there. And if it's, for some reason, if it's starting to go longer than 2 hours between deliveries, then they need to come in. So if they know there's 4 in there and they get to 3 and the 4th one has not come out, and it's past 2 hours, that's when they need to come in, and we need to look at, potentially, is it hung up to where we can manually extract it, or do we need to go do a cesarean section? Feline, only a female cat would demand to be called a queen, so they're called queens. Males are called toms, and young offspring are known as kittens. Spayed females, we take out the ovariohysterectomy, so the ovaries in the uterus. They can do overectomize, where we just take out the ovaries in female cats, but once again, that's a very rare thing to do anymore. Pretty much we do the full spay. Parturition is known as queening in cats. And cats are seasonally polyestrous. They are long day breeders. And so they're going to breed with the daylight. So when the daylight gets long, that's when cats are actually going to become active and come into estrus. They are also, require stimulation to ovulate. And so they don't actually have stimulation from breeding. They will actually continue to stay in heat until they actually do have clitoral stimulation. So they're what they call induced ovulators. So the actual act of mating is actually what induces them to ovulate. Puberty is going to depend on photoperiod, age, and body weight. And usually, if you remember in AMP2, we talked about, and I talked about it in equine also, usually puberty is going to be when an animal achieves 75% of its mature body weight. Is usually when puberty starts. So cats are induced ovulators. So they're going to be daylight long breeders, and they're seasonally polyestrous. When the daylight's short, they will not be in heat. When they do come into heat, there's actually barbs on the penis of the male, of the tom, and these come across the clitoris, and this actually stimulates hormones, feeds back for luteinizing hormone to be released, which then causes them to ovulate. So if you have a female cat in heat, they can stay into heat for months. And this is true also for ferrets, as they're induced ovulators too. They will be in heat for months. And the only way to actually get them out of heat a lot of times is to either spay them or to actually induce ovulation. A lot of times this is done with rubbing a Q-tip over the clitoris. Some behavior specifically to cats is increased vocalization. So they start calling, which is where you get the term cat call from. So increased vocalization, they roll, tread in the same place over and over again. They can become anorexic. They will start spraying their area. Male cats a lot of times will do this to mark their areas, especially when a female is in heat. So you might have a intact tomcat in the house and he starts spraying. It might be because the neighbor has an intact queen next door that's in heat. And so these are some normal behaviors with them. We can also have some problems if they stay in estrus too long, if they're not induced to ovulate, and this is because of high levels of estrogen. Usually the best time to breed a cat for a lot of places that are doing catteries or they're specifically trying to breed cats is about day 3 of estrus is usually the best. And luteinizing hormone after stimulation is released within 10 minutes of copulation, so it's fairly quick. And once again, gestation in cats lasts somewhere between 58 and 70 days. Primary hormones, again, is going to be FSH, stimulate the follicles, luteinizing hormone, progesterone to maintain the pregnancy, estradiol or estrogen to sit there and produce signs of estrus. Prolactin is used to produce milk, and this is going to be found on all species, usually at the end of pregnancy. Prolactin is produced right at the end, usually at the beginning of stage 1, and this increases mammary secretions and causes production of colostrum. And then relaxin is also released, and this goes across all species also to actually loosen up and open up the cervix and widen the birth canal to allow the fetus to be expelled. Stage 1 in cats actually starts with nesting and decreased activity, so they all at once they hide and they actually make a nest in a corner someplace. You'll see this in barn cats. All at once they'll disappear, and you'll see them pop out to go grab something and pop back in. Usually something like hay, or some place in the corner where there's maybe equipment, but they're going to go somewhere that's going to be out of reach of most other animals and where they're going to be ignored. And you'll actually start seeing actual lactation secretions. Stage 2, the fetuses are delivered. In queens, dystocias are actually quite rare. And this is because they actually will sit there and they can actually help themselves, actually assist in their own deliveries. So it's very rare that we actually have to sit there and do C-sections on cats. They usually self-assist. Usually, depending on the litter size, during parturition, stage 2 usually doesn't last probably more than a couple of hours. And then once again, stage 3, the placenta is going to be fully passed and the uterus is going to return to normal. One thing about actually looking at pregnancy in cats is, once again, a lot of times we have started using ultrasound a lot more and have gotten fairly good. You can actually start palpating pregnancy abdominally at about 18 to 20 days, roughly. And then radiograph diagnosis is usually somewhere around after 40 days, with, once again, probably about 45 being the most accurate on. But we can start seeing them on radiographs about 40. Next, we move on to equine. So common terms here: mare, that's intact female; mature male, female horse that's able to be reproductively active. Filly is an immature female horse that's not hit puberty and not sexually mature or active. Stallion is the active, sexually mature and active male. Crypt orchid is a male horse with a retained testicle. And the book makes a distinction between a stallion and a tipped crypt orchid. I really haven't noticed that in the equine world because we call them all stallions, but probably technically they're right that a male with a retained, 1 or 2 retained testicles should probably be properly called a crypt orchid and not a stallion. A colt is a sexually immature, non-active male horse, so they're young, they're before puberty. Sometimes you'll hear colt and foal used interchangeably, but they're actually two different things. Colt is male, filly is female. Foal is more of a general term speaking, either male or female. And usually a foal is usually going to be less than 6 months of age, whereas a colt could be before puberty 1.5 years, just like a filly could be 1.5 years old too. So foals are usually restricted to less than 6 months, and it can be either sex. Foaling is the actual act of parturition. Weanling is a foal, either a filly or colt, that has just been weaned from its mother. Gelding is a castrated male horse or stallion. And then we have spayed or overectomized mares. So in the mares, it's very rare for us to actually remove the uterus, so usually they're overectomized. We'll call them spayed, but we don't actually do that many ovariohysterectomies on horses. Usually what we do is we just do overectomies, where we just remove the ovaries in horses, and it's actually kind of a rare procedure. Usually when most people do it is because it's a performance horse, and it's the people are wanting to use it more for performance and less for breeding, and there's usually some type of issue going on with the mare that makes her not desirable to be used for performance or showing, because of her heat cycles or something with her ovaries. The other thing we have is mares get ovary tumors, and I have actually seen this where we go in and we remove one ovary because it has a tumor, and 1 year or 2 later the other ovary has a tumor, and rather than putting the mare down because they can still be used for riding or performance, we'll just remove the other ovary, and that's the reason why they're overectomized and they have both ovaries removed. Puberty, it usually occurs between 12 and 24 months. It depends on the breeds. It can actually be longer than 24 months, once again, depending on the breed. So if we look at something like ponies, they can actually have their first ovulation as early as 12 months. Once again, this is going to be 75% of their mature body weight. I have seen warm bloods and draft horses that they did not actually start their first heat cycle and ovulation at probably 2.5 years, 30 months. So there is this variation in size. Dogs are fairly clearly defined at 6 months. Every now and then you'll have a Great Dane, maybe goes like 8 months or something like that. But in horses, it does it does follow very much the body weight. And once again, just like in dogs, we have this variation in size from miniature horses that can weigh as little as 200 pounds up to Belgians that can weigh 2,400 pounds. So you have this big weight difference, and so that's kind of the difference here with age, that it can be from 12 months, and I've seen it as long as 30 months before they actually hit their first heat cycle and their first ovulation. Endometrium on mares is a little bit different than the endometrium in some of the other animals, and it's highly folded, and it's actually because of the way that the placenta attaches. So the dog and cat, we've talked about zonary. Remember the horse's placentas. The horse has a diffuse placenta, and their placenta is going to loosely attach all the way across the uterus, and so because of this reason, we have this high amount of endometrial folding. Horses are seasonally polyestrous, just like cats. And so they're going to be long daylight breeders. So horses and cats, they like to breed somewhere between March and September. When the daylight's long here in the northern hemisphere, southern hemisphere, they're going to breed usually September to March because that's when the daylight gets longer in those parts of the world. So when we look at horses, it's important to understand that that they are seasonally polyestrous. When horses come into estrus, we have different follicular phases that we actually look at on them. And generally, they're going to be in estrus on horses on their estrus cycle, usually anywhere from 4 to 7 days on average. And during that time, a lot of times we use ultrasound to actually track their follicular phase. And so they usually start off with small follicles that are not receptive, so they can be showing estrus. They might be receptive, but we know that the first couple of days they're not actually going to sit there and be able to be bred by the stallion when they're into heat. And usually when their follicles get up around 40 millimeters in size, that's usually when they're going to rupture and actually have the better chance of getting bred. One thing about estrus with horses is a lot of times the behavior will start at the start of estrus, and then it will actually extend up to 2 days after ovulation has occurred because of the amount of estrogen in their cycle. The luteal phase, usually somewhere between 4 to 7 days after estrus starts, depending on the horse and the time of season. We do know that estrus is longer when daylight is shorter, and estrus is shorter when daylight is longer. So when we get around like June the 22nd, the longest day of the year, sometimes estrus, I've seen some horses be in 2 days, ovulate and be done. But that's the luteal phase. After the luteal phase with horses, they go into diestrus, and that's going to last, if they're not pregnant, 17 days, and then the estrus cycle starts over again. That's 17 days on average. If they are pregnant, then the interesting thing with horses is we said all the other animals, the corpus luteum maintains pregnancy. And horses, it actually does for a period of time, but horses will actually be bred and pregnant, and I have actually seen them show some signs of estrus starting back again at around 17 days. And the reason for this is mares actually, their corpus luteums only last about 30 days, so they constantly rupture new follicles during pregnancy to make new corpus luteums. And so by the time one corpus luteum is starting to dissolve at 30 days, another corpus luteum has ruptured, another follicle is ruptured, formed another corpus luteum, and it's going to take the place of the first corpus luteum for, say, another 30 days. And so it's not uncommon to actually see mares sometimes come into heat when they're still pregnant. The interesting thing about them is while they'll be in estrus and be pregnant, they won't actually be receptive to the stallion. There's different methods that we use to actually tease the mares. Most common is using a teaser stallion. Sometimes we'll use the breeding stallion to tell. Another very common thing to do is to use ponies. And then we've actually used geldings that we actually give testosterone shots to. Or sometimes we have geldings that will actually still exhibit stallion behavior, and they'll still tease mares. But mares, you'll see in this teasing behavior, what you're seeing right here, and they're saying this is showing teasing behavior. It's very hard for me to say if she's actually in heat. I'm thinking she is, because this is kind of what they do, is they squat down and they lean towards the stallion. When he comes back here to sniff the mare around the back end, and he'll nibble on them, and they will actually do what they call breaking down. So they will actually squat down, they will actually lean towards them, they will raise their tail, and they start doing something called winking. And so this is where the vulva actually at the area of the clitoris starts to open and close very rapidly. And so and you'll actually see the clitoris project out when it opens and then go back in, and the vulva closes. And they do this back and forth, and they'll dribble little amounts of urine at a time. And that's probably what this picture is trying to show. If they're not, this picture could actually be showing her going down and about to try to kick the heck out of him, because her ears are back slightly, so I'm not sure what she's about to do. But if they're not receptive, then they're not receptive, and mares, no means no, and they will very quickly let a stallion know if they're not, because they will bite, kick, or do anything else to tell him to get away from them. So when we look at estrus in horses, a lot of times ovulation usually occurs 48 hours before the end of actual signs of estrus. This is a generalized rule, but it's fairly close. And this is because mares produce a high amount of estrogen that actually stays in the body and still makes them show signs of being in heat when they've actually ovulated. There's a lot of times a window after ovulation in horses, which they're kind of different than some other species, that we can still breed them reliably. We get them just have the same conception rates 12 hours before ovulation and 12 hours post-ovulation. So when we get to some other species, it's important to either impregnate them right before or either right after ovulation. Horses, we have this wider window. Their corpus luteum becomes functional about 5 days post-ovulation. And that's usually somewhere roughly anywhere, they say 8 to 9, can be as much as 12 days from the actual onset of heat. Normally in horses, they get a lot of tone when they're pregnant. When they're in estrus, their cervix and their uterus is extremely relaxed. But when they're pregnant, their cervix and their uterus has extremely tight tone. So we can actually feel that tone a lot of times. And you're not actually, when they become pregnant or they go into diestrus, either pregnant or diestrus, you're not able to easily get through the cervix on the male. If they're not pregnant, then usually we see progesterone start to decrease 14 days after ovulation. By 17 days after ovulation, they're showing signs of estrus again. If they are pregnant, then they're going to maintain it. The interesting thing about horses, when we get here in a minute, we'll talk about parturition and stuff, is what actually they do with their ovaries during pregnancy and who actually maintains the pregnancy. We do a lot of manipulation with horses as far as controlling their heat cycles, and we do this through hormones. We do this through lighting. So they are long day breeders. So a lot of times, starting on, if we're wanting to breed horses early in the wintertime, starting on December the 1st, we will start exposing them to 16 hours of light a day. And usually this change to the pineal body takes about 60 days to be fully effective. So if somebody's wanting to get a mare to come into heat, say March the 1st, and they're wanting to start in February, it's not going to work. If they want it on March the 1st, they need to start back on, well, probably actually, considering there's only 28 days in, or 29 this year in February, they really need to start probably back somewhere about December 28th, 29th. If you want them to be able to breed on February the 1st, we start them on December the 1st, and so we can control them through lighting. There's also controls, we know, with the temperature with mares also, so it's not 100% daylight. And I have actually seen this where we're breeding mares like in April and we get an unexpected cold snap. One time I had a snowstorm come through and I had a bunch of mares that were in heat and cycling, and they shut down as soon as the temperature got cold. So if you're using lighting, it's also very important to also have some way to control the temperature, or to use blankets or something to keep their body warm, because if their body senses it's cold outside, that can actually slow down or actually stop their estrus cycle, usually temporarily, but it can delay you by up to a week. Influences on equine reproduction is most breed associations designate January 1st as the birthdays for all horses of that given year. So if a horse is born on January the 1st, then great. It's truly a year old on January the 1st of this year. So we'll take 2016 as an example. So all foals born on January the 1st will be a year old on January the 1st, 2017. But so will the foals that were born on February the 1st, March the 1st, April the 1st, May the 1st, June the 1st. And when we get around to December 31st, if a foal is born on December 31st, the very next day on January 1st, guess what? It's a year old. So what we have is we have a lot of pressure for foals to be born early in the season. So we do use a lot of daylight to manipulate breeding. We don't, especially in the racehorse world, they don't like in the thoroughbreds and racehorses for them to be born late in the season. Because if you take a May foal as a 2-year-old at a race and a January foal as a 2-year-old race, that's 4 to 5 months difference, and there's a lot of difference in the racing performance in 4 to 5 months. So there's a lot of pressure, especially like up in Kentucky. We use a lot of lights hormones, heated barns and things like that to actually make these mares come in to heat early in the season, usually when they would not breed. And so we're usually trying to breed them somewhere around February the 1st so we can have January babies. Because it's important for competition. We see the same thing with horses that are competing in events such as halter, Western pleasure, going into different futurities, which are competitions for young horses, like in cutting and in reining. The areas of the world we don't really see this in show is as much as in the dressage horses and the hunter jumpers, usually because they start their careers a lot later. Usually those horses are 4 or 5 by the time they actually start showing, whereas racing and some of these other show horses we've talked about, they usually start somewhere at about 2 to 3 years. So age makes a difference. So a lot of times we're trying to make a breeding season to be as close to January the 1st as possible. So a lot of times we actually start breeding horses February the 1st. And usually we stop somewhere, they say July the 15th, but honestly it's usually about July the 1st is when we stop breeding. Because that means that any foals that are born on July the 1st are going to be born right at the end of May. And that's about as old as we want the foals to get. But we really push for them to be as close to January the 1st as possible. There are a couple of breed associations, like the Tennessee Walking Horse and Andalusian, that do not use January 1st as an imposed birth date, that they actually use the actual documented day of birth as their birthday instead of January the 1st. But those are some rare associations. Most everybody else imposes the date of January the 1st. Some important things to know when we look at breeding mares is actually conformation. And so there's actually a scoring system that we actually use, and it's a 1 through 4 method, 1 being perfect, 4 being very poor vulva tone, meaning that feces and easily can get down into the vulva, meaning that it's actually very easy for urine pooling to actually occur within the vaginal area. A 1 is basically straight up and down, whereas a 4 is just about horizontal. It means that the vulva is almost flat underneath the rectum, and that all the feces, good chance that it's going to go down in. A lot of times we're looking at that opening at the caudal pubic bone, and there's actually a picture where they're showing some stuff with some Q-tips in the books, and I think on the next slide. So it's very important, like we showed in equine, to do a proper preparation before we breed them, either AI or live cover. We want to clean thoroughly that perineum area. A lot of times we will wrap the tail. We like to wash with soap, and we prefer soap that's antibacterial. We just like straight soap because we don't want to kill the healthy flora there and actually allow a pathogen to come in. They talk about using a sterile speculum to actually breathe through a speculum and visualize the cervix, and that's one way to do that. The other way that we actually can also do it is the way that we showed you, where we actually insert our hand in the pipette. So there's 2 different techniques of actually doing this to do artificial insemination. And here they're showing Q-tips where they're actually showing this mare actually has very tight. A lot of times what we'll do is take our fingers beforehand, and there should be very tight tone. When you pull back on this, there should be a little bit of resistance, and it should snap right back closed. So this is actually fairly normal. This is a 1. You can see where the rectum is not more cranial to the vulva, and that the vulva is not more caudal. So this is pretty straight up and down. Fairly tight right here on the tone. This is the type of tone that we like to see in a mare. You don't want it to where this naturally wants to open up on its own, or if you pull it open, you don't want it to stay open or have a large cavity behind it. That would be abnormal. Or once again, we don't want it sloped. If you look at Bonnie, and this happens with age with all mares, that the rectum actually goes cranial and the vulva actually becomes more caudal, and you can actually see where she's probably not quite the most extreme at 4, but she's about a 3 on the grading scale. So artificial insemination, we kind of discussed that, but it's pretty much prepare the perineum. They talk about using a sterile glove that you can put your arm in with placing an insemination pipette. You can also use a speculum to do the same thing, and with a speculum you just visualize your way and place the pipette into the cervix. Whereas if you're using an insemination glove, you actually protect that pipette and then the tip of it with your pointer finger, and then you go in as sterilely as you can, and then you stick your finger just into the very caudal cervix, and then you just put the pipette just barely beyond that, and you're actually, either way you're going, you're putting semen directly into the cervix. The most common way is with the glove. They talk about adding some air immediately before entry, and that would actually be something that would be inconsistent with most people doing reproductive work with inseminating horses. And the reason I say that is we don't like any air with semen. The only time that we'll do that is sometimes people will pull up some air and push in the extra semen, but even that is somewhat controversial now because air kills semen. Pregnancy, the placenta attaches diffusely, and so it's that diffuse placenta we talked about. There's many layers between the blood flow of fetus and the mother. Unlike other species like the zonary, or when we get into bovine here with cotyledon, or the disc in humans and rodents and lagomorphs, there's a lot of very close blood supply contact between mother and fetus, but not with the horse. And this diffuse placenta is what causes horses not to be able to twin. So this definitely has a lot to do with their inability to twin, because it takes so much placenta to actually get a good diffusion across of oxygen and carbon dioxide to bring oxygen in, carbon dioxide out, glucose and amino acids in, and wastes out. A lot of times we diagnose pregnancy via ultrasound or palpation. It's important to remember that we can actually see the vesicle starting at 14 days, 16 days most reliably. We call it a vesicle at that time because it's not firmly attached. We can see a heartbeat on the embryo starting at day 22, more reliable around day 25, 26. And we don't actually call them pregnant until we're at day 45 and beyond, because that's when the placenta is fully attached to the uterus. So full actual diagnosis of pregnancy only occurs after 45 days of gestation. Horses, once again, there's this great variability in gestation. It can be as short as 320 days for things, or actually 310 days for miniature horses, 320 days for ponies and some small breeds of horses. 342 is the average. That's what you'll find most quarter horses and thoroughbreds at. Draft horses can go 360 and beyond. I've actually seen them go as long as 380 days on some of them. Sometimes gestation, especially with age and the number of pregnancies, gets longer with each pregnancy, and so you might have a horse that starts off at, say, 335 days. And when she's a 2-year-old, and she might be at 360 days by the time that she's 20 years old. And that would not be something uncommon to find, because gestation does seem to stretch out with age and number of pregnancies. And so the more they have, the longer it's going to take. The only time that we get worried about length if gestation is going too long is usually if we've had them on infected fescue. One thing also about going back here to pregnancy in horses is after 150 days, the placenta and the foal take over the pregnancy, and so they're the ones that are actually going to maintain the pregnancy, is the placenta and the foal. Inducing parturition, this is very risky in horses because of the great variability in gestation. And also, in other species, we can induce because it's the corpus luteum that decides when the calf is going to be born, when the kitten is going to be born, when the puppy is going to be born. In horses, it is the placenta and the foal that makes the decision. And the biggest problem that we have with inducing parturition in horses is the foals aren't ready to come out, and so their lungs are not developed enough to actually let them survive. And personally myself, I won't induce them because every time I've ever induced a mare to have a foal, I've had a train wreck afterwards with the foal, and I'm 0 for 7 right now. So I've done 7 of these, and I've never actually had a foal actually survive. Usually anywhere from 6 hours to 2 weeks later, they die, and it's usually due to some type of respiratory distress. After parturition, we do like to assess colostrum levels in the foals. One thing that they have here is they also have assessing colostrum levels, electrolyte levels, to tell us when the mare is ready to foal. And usually if you're doing that, it's going to tell you it's within 24 hours. So usually there's no use in inducing them anyways because they're going to have it. But we do like to look at colostrum usually within 24 hours of the foal being born. Before they induce them, they do like to have the dilation of the cervix. They say 2.5 centimeters. I actually like to have it more than that. I like to be able to get my fingers in there more than that if I was going to induce them. And so most of the people I do know that are successful at inducing them, semi-successful I should say, at inducing them, because it's risky, because even the people I know that do induce them usually only have a survival rate at best of about 50%, and usually they're doing it for medical reasons. But they usually like to have it more dilated than that, because a lot of times what you'll get is an extreme dystocia. If it's actually, if it is at 2.5 centimeters, usually they're wanting it to be at least a 3 to a 4 centimeters dilation before they'll induce a mare. And usually this is a mare that has something like salmonellosis, and so they're really sick and they're about to give birth anyways, and so they're trying to do a salvage procedure because they think they're about to lose the mare. So they're trying to get the foal out without having to do a cesarean, where they know they will lose the mare and most likely the foal. And to induce mares, they use oxytocin as the most common thing. The 3 stages with horses: stage 1, producing milk and starting the behavior and contractions. This is very variable. It can be as short as 6 hours. I've seen them pretty much go into it and boom, it's done, to where I have been out there for 2 weeks off and on looking at them. So there is a lot of variability within stage 1 in horses. But once stage 2 actually begins with horses, once there's actually the rupture of the fetal membranes of the choriolantois and the water breaks, they say that the fetus has to be without in 70 minutes. If you remember me saying in equine, I want them out within 15 minutes, preferably. So the book's saying 70 minutes, but if you're actually working in equine medicine, you got about 15 minutes to get them out. And then usually after that, things start to go bad. So that's why I added the or less in here for survival, because really I want them out within 15 minutes. If not, I'm going after them because I don't have too much longer. Most of the ones, if the water's broken, it's taken an hour to get them out. They're usually a dead fetus. So a lot of times if they're not out within 15 minutes, I've had to go in there for them. Sometimes I've gotten them out just in time. Other times they're already dead. So we want them out fairly quick. And then 3 is the placenta coming out, and usually that's going to happen within 12 hours. We want to actually see stage 3 over with within 12 hours. If it's not, then we need to go in there and remove the retained placenta. Interesting thing about horses is, since the placenta takes over pregnancy, is that they're able to actually come back into estrus right after foaling, and they actually invert and clean out their or involute and clean out their uterus very fast, and so they're able to actually rebreed successfully somewhere, from 6 days on, if when their foal heat is. So they're actually able to do this fairly well and get themselves back pregnant fairly quickly. And this is a horse in parturition right here. This is stage 2. This is kind of a normal delivery. You can still see part of the fetal membranes intact here. You can see the nostril, you can see the legs. You can see the mare straining. She has a wrapped tail. She's out in a nice grassy paddock, which is really where I like to have them because she's not up against the fence. She's not in shavings, and she's not where there's a bunch of organic debris, aka horse manure right here. You can see it's a nice clean area. This is where mares will find out. They'll find out where that nice clean area is naturally. Greatly reduces the risk of infection of the foals. And said this right here, when you see this starting, this should be 15 minutes tops, and they should be out. Bovine, some of the terminology up here is heifer. And so this is any cow that's less than 2 years old. And really we use heifer for one that has not calved yet. So less than 2 years old and has not had a calf. Once they have a calf, they become a cow. Bull is a male. Steer is a castrated male. Cow is still a castrated cow or a spayed cow. So we don't really change terminology on that. Calf is a young bovine. Usually it's going to be, say, 6 months or less. We usually call them a calf. And then calving is the actual delivery of the fetus. So gestation in cattle is about 9 months. Usually we desire their first calving, actually it'll be a little bit past 2 years. Usually the first pregnancy, a lot of times in cattle we start breeding them at about 15 months. This is usually when they come into puberty for most breeds. Once again, this can be varied. There are some breeds that are smaller in size that, and it's been known on certain bloodlines and stuff that their first, say like a Jersey cow in the dairy world, that they actually can be bred as soon as 12 months at a year. They'll start showing signs of puberty. Some bigger Holsteins are on average they're 15 months, but they can actually be 18 months before we actually get them. So this is variable once again on what their size is going to be, and once they reach 75% of their mature body weight, that's when they're going to actually start showing signs of estrus, and they'll actually enter puberty and we can breed them. And a big reason why we breed them so young is for production reasons. Dairy cattle is trying to get them into lactation somewhere around 2 years of age, where once they have that calf, they can start milking. In beef cattle, we have a number of years that we're going to be able to use them, and it's all about trying to produce a number of foals for a production model. They're polyestrous, so everything, dogs we've talked about have only come in twice a year on a cycle. Horses and cats have been seasonally polyestrous, meaning daylight's going to determine when they're going to come in, but bovine, and then we don't actually have any slides on swine in here, but you'll find swine also. Both swine and bovine end up being polyestrous, meaning that they come into heat year-round regardless of daylight or temperature. They're going to keep this consistent estrus cycle. Cows actually come into estrus for a very short period of time. And so a lot of times what happens is they come in usually for less than a day, that they'll actually be showing signs of estrus. And they usually ovulate somewhere about 8 to 12 hours after estrus has actually ceased. So when they go out of heat is actually when they, about 8 to 12 hours after they stop being receptive to the bull, is when they're actually going to sit there and ovulate. Cows are known to display homosexual behavior, meaning that if one cow is in heat and another cow is in heat, they actually do riding behavior. So a lot of times we don't actually have to have a bull for teasing methods. We can actually use the other cows, and we can actually use some different techniques to actually see in a herd which cows have been ridden and which cows have not. So some of our teasing methods where we used to, that we'll talk about using a bull or something called a free Martin heifer, are some methods that we can use in herds to look for teasing and stuff, but we don't necessarily have to, because for whatever reason, when cows are in heat, they will actually go and mount other cows that are in heat. Their cycles are 21 days long. Usually between estrus to estrus is 21 days. If they don't get pregnant in 21 days, they'll be back in estrus again. And they're in an estrus for less than 24 hours. The book says 8 to 18 hours, which is probably a pretty good average. It's a short window. I learned it as 12 is 16 on average, as long as 24. But that's about as long as they're going to be. Their follicular phase is fairly rapid. They get heavy stimulation of FSH, and so they get their follicles to grow really fast. Their estrogen peaks up really fast, And this estrogen then actually sends a major signal for a bunch of luteinizing hormone, or LH, to be released. And so all at once, the FSH and the estrogen shot off, the LH comes along, and then usually right after estrus, you get a peak LH that causes ovulation and corpus luteum formation at about 8 to 12 hours after estrus stopped. One thing that cattle do is we have estrus. We've talked about diestrus, which is where progesterone dominates. All species have something called medestrus, which is right in between. But cows actually have a very strong medestrus. So during medestrus, what actually happens in cattle is somewhere about 5 days diestrus starts. The corpus luteum takes over. But in the meanwhile, about 2 or 3 days after estrus, we'll actually see kind of a little bit of a blood-tinged mucoid discharge during medestrus in cattle. And so this is a lot of times a farmer might, or somebody that's new with cattle, will be talking about seeing this mucousy bloody discharge a cow had one day or for 2 days, and then it went away, and you can tell them, well, you just missed them being in heat. And then once again, diestrus is going to be, the corpus luteum is going to take over and is going to maintain the heat cycle, or the pregnancy cycle, excuse me, not the heat cycle, the pregnancy cycle in the cow. If they're not pregnant 21 days later, they're going to come back in. If they are pregnant, then the corpus luteum is going to maintain the pregnancy. We do a lot of artificial insemination in cows, and so usually we like to inseminate them about 12 hours after them being observed in heat. And usually how we observe them in heat, if we're going to do artificial insemination, if we don't have the bull out in the pasture. So a lot of things, if we have the bull living in the pasture with the cow, we don't really worry about some of these other things out here as far as trying to figure out when their heat cycle is. We let the bull do it. But we do a lot of artificial insemination, especially in dairies and especially with registered herds. We do a lot of it. And so we actually can use heat detector patches, and so these are glue patches that you can put on their tail, and it's white, and then once they're mounted, it turns red, and they're only going to be mounted if they're in heat. And so they use things like vasectomized bulls as teaser animals, that they'll put a bull that's had a vasectomy, or sometimes they will redirect their penis at a 45-degree angle to where they can't actually get inside of a cow and breed them, and then they will actually use these bulls mounting these cows on these heat detector patches to figure out which cows are in heat and which ones need to be AI'd. Alternatively, what a lot of people do, because these heat detector patches are really expensive, is they will use these crayon sticks, and they will put a bunch of red crayon on the back of the cow, and if they see it smeared off to the side, then it works as well as the heat detector patch, and it's probably 1/100th of a cost. The other thing that we'll do is there's something called free Martin heifers, and these are heifers that are born twin to a male, and they don't actually make ovaries, and they don't actually have a uterus. They just have a dead end where a cervix is supposed to be. And so some people will use these free Martin heifers because they will still mount. They don't have any female hormones whatsoever. They will give them artificial testosterone. When they do this, they cannot go in the food supply. So when they put them down, they just have to be buried someplace. But they can't go into the food supply if you do this. But they will give them testosterone. They will act like a bull. They will mount like a bull. They will do everything like a bull. And there's no chance of getting them pregnant within a herd. The other time that we use some of these techniques also is trying to figure out when animals are leaving puberty and they're actually ready to be bred the first time. So sometimes we'll have a pen of heifers, and we're trying to figure out which heifers are actually ready to go be put out with a bull and actually be bred and have actually come into heat. And we'll use a lot of these same heat detector patches, crayons, and different things in these animals trying to detect heat. Gestation's about 9 months, 279 to 283 days. Most all of our ruminants we're going to talk about use cotyledonary placental attachments. So they're going to have a cotyledon on the placenta side, something called a carnucle on the placentome or on the uterus side. And so there's going to be these specific locations. This is not like the horse where it's diffusely across the uterus. These are going to be specific locations where the placenta is actually going to interdigitate and grow in to the uterus, and there's very close blood supply in these areas. On average, a cow has about 64 carnucles. It's very important to know that If you damage one of these carbuncles in a cow or two, a couple of these different carbuncles, it can actually be the difference between them carrying to term and them aborting somewhere about 7 or 8 months of pregnancy and not having more live offspring. So anytime that we have to deal with like a prolapsed uterus or a C-section or removing retained placentas, we're very particular not to try to damage those carbuncles at all. Diagnosis is usually done by palpation. It's fairly accurate by palpation after 30 days. Unlike a horse and cattle, when they're pregnant, they have very loose tone. When cattle are in heat, they have very strong tone. And this kind of goes back there what we were talking about with their estrogen cycle, with them having back up here with met-estrus, is that during met-estrus and during estrus, there's a lot of blood that gets into their uterus and into their cervix, and so they get this tremendous tone, and during pregnancy, they're very flaccid. And so you can actually palpate, and at 30 days, it kind of feels like a little hen egg. And so people are fairly accurate, and that's how most diagnosis is done, through palpation. For a lot of your dairy herds and your registered herds now, they do use ultrasound. And part of the reason they're doing ultrasound is to actually not only help confirm the pregnancy, but to make sure that there's nothing wrong fetus during that time or with the embryo. And the big thing is to make sure that we don't accidentally have twins and we're going to have something like free martins. Because sometimes they can actually do fetal sexting on these and actually see through looking at it, do I have a bull calf and a heifer together? If they do, a lot of times they'll abort them and they'll rebreed the female, if they're, especially like in a dairy operation where the female is more valuable than the male. Sometimes in a registered herd they leave them alone, but they know that they're going to have twins anyways. And if you're going to save one of them, unfortunately, it's going to be the male and not the female in a free martin situation. In parturition, stage 1, cervix relax, the uterus starts to contract. In cattle, they get something called a Ferguson's reflex that goes on. And I'm not exactly sure. I don't remember a Ferguson's reflex because this is the first time I've seen Ferguson's reflex. But basically, they say it's about 6 to 24 hours, and I'm going to say it's probably more in the line of about 12 to 24 hours that you'll actually start to see them actually start to have the contraction starting with them. One thing with cattle is stage 2 with the rupture of the membranes is there's a long variability here of anywhere from 2 to 12 hours. So they don't usually rupture and come out immediately right away. Sometimes they do. Sometimes they'll come out within the first hour. But usually when they enter stage 2 in cattle, it takes about 2 hours for them to actually come out. And it can be as long as 12 hours when the fetus is delivered. Stage 3 in cattle, for the placenta to be passed fully, is usually within 3 days. They say up to weeks, but weeks is not acceptable. Usually it can take up to 3 days. We're all right with it taking up to 3 days. Most of the time I say within 12 to 24 hours it's going to be passed. But it can take up to 3 days. That's all right. If it goes past 3 days, we're doing something to actually try to get the placenta out. And in fact, a lot of cattle people really don't like it to take more than a day because there is an increased chance of not only infection to the cow, but also predation. Involution in the cow, though, does take a long time. It takes a long time for their uterus to get normal. Unlike a horse, where this happens fairly rapidly, in cattle, it takes about 2 months and can take as long as 4 months. So usually after a calves, unlike horses where you can breed them back within the first 2 weeks, cows are not actually going to come back into heat because their ovaries need rest. Their ovaries take about 2 or 3 months off. So it's usually somewhere between 60 and 90 days before their uterus and their ovaries are ready to go back into estrus and become pregnant again. We're going to talk about ovine and caprine here. And these are going to be, both of these are seasonally polyestrous animals, meaning they're going to come in to heat with daylight at certain times. When we look at them, they're going to be short day breeders, unlike dogs and cats that are long day breeders. And, horses and cats are going to come into heat when the daylight is very long. And sheep and goats are going to come in when it's very short. So usually they're going to breed somewhere between about September and the end of December. Puberty is going to be, once again, dependent on body weight. When they achieve about 75% of adult weight, that's usually when you're going to have puberty. A ewe is a female sheep, a ram is a male sheep, and a wether is a castrated male sheep. Ewe lambs are those that are less female sheep that are less than a year old. Ram lambs are usually those that are less than a year old. And of course, lamb in general could be either species. So they are seasonally polyestrous, but they're short day breeders, and so in the northern hemisphere they breed usually September through December. In the southern hemisphere they're going to usually breed March through June. Their estrus cycle is about 17 days long, from the end of one estrus cycle to the beginning of the next. And usually ovulation occurs within 24 to 30 hours of the signs of estrus. And usually right after ovulation, estrus is going to stop. One thing with knowing about ovine is that body condition score and wool coat is very important. If they have a very poor wool coat or they have a very poor body condition, they don't have enough fat on their body, they're not actually going to get pregnant. We can use things like daylight to help and artificial light to help synchronize estrus cycles. So we can actually put them in an environment and actually alter the light and alter their cycles between them. And conversely, there's a lot of places that raise like show sheep and stuff that will actually keep them in like dark barns, trying to simulate wintertime when the daylight is shorter, and they'll actually sit there and be able to breed them to lamb like in the middle of May or June, when they normally wouldn't, by actually altering the daylight. So mating behaviors, a lot of times, multiple rams will fight over females. So a lot of times we like to have one ram in the herd. But a lot of times the ewe will actually seek out the ram when they're in estrus. So they'll actually come over, they will lean, they will actually sit there and make gestures at the ram and get him to attract attention. Actually put markers on rams. And whenever he goes to mount, these markers can actually sit there and actually tell you whether or not a ewe has been covered. Gestation ranges pretty narrow range on sheep, about 144 to 147 days. Twinning is not uncommon with them during gestation. We can sit there and look at progesterone levels and kind of tell when they're about to lamb. We can actually check pregnancy also by using ultrasound. Goats are not that much different. Some of our terminology is. Doe is a female, buck is a male, wether is once again a castrated male, kid is a young goat, kidding is having the fetus. Their cycle, instead of being about 17 days, is usually 21 days from estrus to the next estrus. Estrus usually in them lasts, once again, it's about 24, 36 hours. So usually a day and a half. Ovulation is very compatible to the ewe, so is the estrus behaviors. The female goats, the doe is going to go seek out the buck. And the main thing here is the average gestation is going to be about 145 to 155 days. So there's a bit more variation in goats than there is in sheep. They're kind of close to the same range, but goats can go a little bit further. Goats, twinning is also very common, but so is triplets. So it's important to know that goats, a lot of times, with sheep, twinning's not uncommon. We see it commonly. But goats, we actually get a lot of triplets. Our camelids, especially llamas and alpacas, usually their puberty is usually somewhere between 10 and 12 months. They have a variation in estrus, and it can actually go longer. Because one thing is that they actually need, need to be induced ovulators also. So that's why we actually have this variation here. One thing about young males is a lot of times they're unable to breed because there are actually adhesions between the penis and the prepuce. And usually they're not able to breed until about 3 years of age, because that's when these adhesions actually break down and they're actually able to then breed a female. Pregnancy is usually going to be somewhere between 330 and 350 days. So it's somewhere in that same range that we find horses to be in, is where they're at. When we actually look at gestation on them or parturition on them, they have something that they call unpacking, which usually starts, the first stage is usually about an hour to 2 hours where they're actually in heat. So it's one of the shortest. And then they go pretty much straight into expulsion of the fetus. So they have a very short stage one, and a normally short one for most species. And then the fetus comes out within 20 to 30 minutes. And then the placenta is expelled fully within usually about 4 hours. And then they're actually able to come back into fertility and rebreed at 20 days postpartum. Breeding soundness exams, factors involved, looking at reproductive characteristics of the male. We're wanting to see, are the testicles of the proper size, the proper location, are both of them actually there? Is the penis in the proper location? If it's deviated at all to where they're not actually able to breed, that could be a problem if you're wanting to do live quality or live coverage breeding. Semen quality, this is actually looking at how good the motility and what the quality of the semen is actually like. Attitude is something that we do look at sometimes in large animals, although that's not always a very big deciding factor for breeding, and along with disposition. But something that's very important is to make sure that they have proper libido. So we want them to have very good sex drive. And then we're looking to make sure there's not any other abnormalities. So sometimes it's not uncommon to do blood work and make sure that we're not seeing renal or kidney disease. We also want to know when we do these things, has the animal had any type of illnesses, medications, vaccinations, anything like that within the last 3 months, because these can be very important and that can actually affect sperm quality when we're looking at semen quality. A lot of times we start off with a scrotal exam. We want to make sure the testicles are the proper size, that they're proper firmness, and that they're in the proper location, and that there is 2 of them and not just 1. And there is a definite difference in doing the exam between species. So dogs are a little bit different. A lot of times when we look at the penis, we're looking more to make sure it's in the proper position. We check the testicles, make sure that they're not torsed, make sure they're the proper feel. Those are the main things that we're looking at on them. When we're looking at, say, like a boar, we're looking at the testicles too, but we place a lot more on the examination of the penis because it has to have that proper corkscrew. If it doesn't have that proper corkscrew, then they're not actually going to be able to live cover a female. And so that plays a very significant role. Bulls, we have a very narrow range that we want them to have that's acceptable for sperm count. If it falls below usually a billion per mil, we consider that to be infertile. Whereas horses, we can have a greater range. We like to see them have somewhere between 150 million and 600 million per mil. So we have this range that kind of differs between species also. Methods of collection. There can be using artificial vaginas. This is very common in horses. You might have something like a collection jar for a pig or a dog, because a lot of times with them, you're actually squeezing or holding onto the penis, and the stimulation of the glands makes them ejaculate. And so a lot of times that's into a collection bottle. There's several different ways that we can get this. We also use collection bottles a lot of times with bulls, but with bulls we actually have these machines that are called electroejaculators that actually stimulate their accessory sex glands and actually cause them to ejaculate. So there's some variation on how we collect the samples and the ways that we actually do this. The most important thing when we do all this is definitely looking at semen quality for males. That's probably the most important thing is, are they able to physically breed, that there's not any deviation or issues with the penis, and then what does that sperm actually look like? Is it actually got high level motilities and the proper numbers? And the female, it's looking at reproductive system, making sure that the vulva is proper, that there's not any signs of any type of infection or disease, checking for their history, doing a proper vaginal exam. A lot of times we'll do an ultrasound exam. Try to make sure that there's no signs like in dogs that they've actually been spayed. In horses and cattle, a lot of times we'll do ultrasounds of the reproductive tract and make sure that it looks all right. Sometimes we'll actually even do things like cultures looking for infections or endometrial biopsies to make sure that there's no signs of any type of disease. And here's an example of an endometrial biopsy from a mare where we're actually looking and making sure that there's no signs of any disease to the endometrium.